I started the session saying, I might prefer this soft drink to maybe something more healthy, or I might prefer the healthier alternative of salads to a soft drink. That's my personal orientation. The point is, anytime we take decisions as individuals, as government functionaries, or for that matter even as private sector executives, a lot of our decisions are blinkered. A lot of our decisions are backed by our own personal sense of values. It's defined by our own background, educational background, financial background, so on. But as a government functionary, when I come out with an e-government initiative which is going to impact the people, the citizens of my jurisdiction, then I have to be very careful. I cannot let my thinking alone decide the contours of this initiative. So this is where evidence-based planning has a role to play. The easiest way to understand evidence-based planning is to look at the medical sector. When you or I, we go to the doctor, depending on your age, you probably might not have come across it, but for people of our age, we know that when we used to go to the doctor, there were very few tests which were done. Maybe use this stethoscope, ask a few questions, and then medicines used to be prescribed, at least by the general practitioners, the family doctors. But today that is seldom the case. You go to a doctor, even your family doctor, most likely, more often than not, the doctor is likely to suggest get a blood test done, get an X-ray taken, get your ECG, whatever. So this new way of thinking has really taken over the medical establishment. The idea that decisions in medical care should be based on the latest and best knowledge of what actually works. Dr. David Sackett is the name which is the individual most associated with this evidence-based medicine, and he defines this as an explicit and judicious use of current best evidence in making decisions about the care of individual patients. You might ask, what else is there besides evidence to make medical decisions? Like I said, people of our generation have seen medical decisions being taken based on the knowledge gained by the doctors in medical schools, long-standing practices, traditions, or based on patterns gained from experience. I must also add that even now, some studies have shown that only about 20 to 30% of medical decisions are evidence-based. A lot of decisions, other times, the decisions are based on practices and so on. And I must also add, a lot of times decisions are taken by doctors based on information from vendors who have products or services to sell. So even though one might say that evidence is clearly pointed, clearly suggested in medical cases, we find that the practice is not always evidence-based. The same holds true for managers and decision makers in the government and in the private sector too. In fact, we can argue that managers, especially in the government, are probably much less eager or much less able to rely on data for making decisions. We will develop the contents of evidence in various other sessions. When we talk about project management, we'll bring in some evidence. When we talk about business models, we'll bring in more ideas of evidence. But for the time being, for this session, I just want to introduce to you the idea that when you conceptualize an e-government initiative, you should factor in evidence. But I would also like to add a cautionary note. There is evidence and there is evidence. It's not always easy just because there is evidence that we can start using it. For one thing, there is far too much evidence. You only have to Google some phrase to know how much data you're going to get, how much information you're going to get. Which of these is right? The evidence may not apply. First of all, there can be too much of evidence. Secondly, you don't know which of these applies, which of these are relevant. So you have to apply a lot. You have to figure out, do a lot of analysis on this. And thirdly, evidence can be misleading. They can be misleading, especially because the decision makers themselves may try to mislead themselves through selective use of evidence. This is what I meant. So if I am a doctor, then I'm more interested perhaps in health domain of my district than in education domain, because that is my way of thinking as a doctor. So all my training, my culture, my background, sometimes, or maybe more than sometimes, forces me to think in a particular way which I am comfortable with. So we have to be careful. Even when we use evidence, we have to be careful that we don't get carried away.